I am Dr. Aniket Mohite. I am a hematologist, hemato-oncologist and a bone marrow transplant physician at Jahangir Hospital. So today we'll be discussing on dengue and HLH. In the current dengue season that has been going on for the last 4-6 months, what we are noticing is a lot of patients are coming with very low WBC count, very low hemoglobins or very low platelets, or sometimes very high hemoglobin as well. They are presenting with their own immune system damaging their own cells, which is not allowing or engulfing. So in a layman terms, you call it as your own body is destroying or eating up your own cells. That is what is hemophagocytosis, and it is not allowing your body production from the marrow to happen. So the white cell count or the total WBC count is low and the platelets are not growing up, or it is the destruction process is far more predominant than the production process. So that is not allowing your platelet numbers to grow. Well, it has treatment and it does have a good prognosis if it is treated and catched up early. So what does HLH mean? HLH is hemophagolymphohistiocytosis. Well, this is something like Greek and Latin for all of us. To simplify, there are immune cells which fight against viral infection or any infection in our body. So whenever we have an infection, our body mounts an immune response. If there is an over-robust, that the immune system is overacting than what is limited to just limit that infection in the body is like any immune system disorders like lupus or rheumatoid arthritis that we all have, which are all rheumatological diseases, or they are basically damaging our own body system. A similar immune response which is over robust is damaging your organ. So it can also damage the liver, kidneys, heart as well as brain. So the extent of damage will determine how bad the patient comes in with. Sometimes they can present with a very small liver enzymes of 200, 500 to an extent that they can have liver enzymes extending to 20,000, 30,000 and so on, or frank liver and renal failure. So how do we diagnose this? The presentations of this is quite overlapping with the usual dengue syndrome, that they can present with fevers which are high grade. Usually dengue fever will settle down by day 4 or day 5. If the fever continues to occur beyond day 5, this is something alarming. But in the current dengue season, we are seeing the HLH starting from day 3 itself. So doing a ferritin, what are the diagnostic markers of HLH? Having a fever, having organomegaly or lymphadenopathy, cytopenias, your immune is over robust, which will give rise to increase in the inflammatory markers like ferritin, which will be beyond 500. It was the required cutoff, but it can sometimes go as high as 20,000, 50,000 and 60,000. So an immediate suspicion and starting steroids is the treatment which can prevent organ damage and help the cytopenias to recover. Sometimes it is fulminant and you can require chemotherapy like agents like etoposide, which is a very active cell killer agent. It is a drug which is used in cancer chemotherapy and has some side effects, but it is used very precautiously in patients who have ferritin more than 20 or 30,000, and it does have a good response. The dose can be used between 50 to 150 milligram per meter square once or twice a week. Dengue HLH per se has a very good prognosis if you consider from the HLH point of view. So an early diagnosis, a high end of suspicion and a quick therapy with steroids, especially with dexamethasone 10 milligram per meter square for 3 to 5 days, then taper and stop. And in selective cases, a role of etoposide would be a very good protocol to save lives. In the initial wave, we have seen patients not giving us even a window of 24 hours. Like as soon as we diagnosed, some of them succumbed because of the multi-organ failure so quickly. So doing this as a protocol of doing a ferritin, LDH, LFTs every 48 hourly and monitoring the fever, monitoring the WBC counts every 12 hourly will give us a trend as to how the body is responding and whether the trajectory of the platelet going up and the ferritin going down, that is, the immune response is getting better, the destruction process is being suppressed with the immunosuppressants like steroids, and the body's production levels of platelets, of WBC, as well as recovery of the liver enzymes gives us a trend that the patient is recovering from HLH. Thank you.